Bonjour tout le monde. Hello, everyone. Welcome to today's online event featuring a very great speaker who will be discussing dismantling anti-Black systemic racism in medicine. Before we begin today's event, we would like to begin with an acknowledgement that N4 is hosted at CHIO, which is located in Ottawa, Ontario. Ottawa is built on unceded Algonquin Anishinaabe territory. The peoples of the Algonquin Anishinaabe Nation have lived on this territory for millennia, and we honor them and this land. Their culture and presence have nurtured and continue to nurture this land. We also honor all First Nations, Inuit, and Métis peoples and their valuable past and present contributions to this land. My name is Mariah Maddock. I use the pronouns she and her, and I am a project coordinator with N4. I will be hosting and moderating today's presentation. My co-host is Andrew Tomeyer, and Andrew will be monitoring the question and answer and chat box today. And I'm very pleased to introduce to you our speaker, Dr. Kwadwo Kyeremanteng. Dr. Kyeremanteng is the department head of the critical care at the Ottawa Hospital. He dedicates his time to care for the sickest of the sick patients in the intensive care unit. As a researcher, he is interested in using ICU resources more efficiently and improving access to palliative care in the ICU. To help do this, he founded the Resource Optimization Network, a multidisciplinary research group working to reduce health spending in this area without compromising care. In September of 2019, Dr. Kyeremanteng launched his ever-growing podcast, Solving Healthcare with Kwadwo Kyermenteng. These podcasts feature interviews and discussions on the topic of improving healthcare delivery in Canada. Underpinned by the values of cost effectiveness, dignity, and justice, these podcasts will challenge the status quo, leaving no stone unturned as we explore gaps, assumptions, and different perspectives in the pursuit of finding solutions to problems in Canada's healthcare system. During the COVID-19 pandemic, Dr. Kyeremanteng created Solving Wellness, a virtual health and wellness platform for healthcare professionals. Solving Wellness has been helping address healthcare burnout and providing health, fitness, and self-care for its members. Welcome, Dr. Kyeremanteng. Thank you so much for joining us today. We're really looking forward to your talk.
Thank you so much, Mariah. That's a very kind introduction.
And just a reminder, we will be recording today's event and it will be uploaded to our N4 platform with a transcript as soon as it becomes available. And should any technical issues during this webinar arise, we will inform you with details for an alternate makeup session. And we also want to tell you a little bit about how you can participate today. We have opened up the question and answer box, and we invite you to write your questions in the Q&A window. And we know that sometimes many of you might have a similar question or be interested in a particular response. So you have the option of upvoting questions today, and we will prioritize which questions we ask Dr. Kyeremanteng first based on that question and answer box. And our speaker today has no conflicts of interest to declare. So with that said, I will hand it over to you, Dr. K.
As I said, Mariah, that was a very kind introduction. I really like to thank you and Andrew for getting me prepped for this talk, and meant a lot to be able to interact with you guys. And just for the N4 organization overall, I just want to give some props when props are due. Like what you guys are doing to help newcomers navigate to the system and really better themselves is truly remarkable. When I sit on the CHIO board, and we got a presentation a few months back, and I was blown away. I was really blown away at what is going on with N4 and how they're affecting lives, and it's really incredible to see. So it was a true privilege when I was asked to speak, to be able to speak with you today. So I just want to thank for the invite. And so, yeah, my name is Kwadwo Kyeremanteng. As Mariah mentioned, I am a ICU and palliative care physician. And as many of you that are listening now, like my life was truly shook after seeing the events with the George Floyd incident. And the world changed. But going through that video and watching that video was one of the most disheartening and painful experiences I could think of in a long time. Because when you see that level of brutality on a human being that looks like you, and realizing that they're being treated like an animal, and this being quote unquote acceptable in society, you can't help not to be shook. And it was, not to get into the details, but even seeing a grown man ask for his mom and being treated in a way that you wouldn't wish on your enemy, really was challenging. It was hard, and it takes you back to all the kind of racist and hate experiences that you take on personally. Like I grew up in Edmonton, Alberta, and there wasn't many BIPOC members in the community, and it takes you back to when you were as young as 5, 6 years old, being called the N-word. You look like a monkey. Go back to Africa. Especially playing hockey, getting a lot of racial slurs being thrown towards you, and it brings you back to all those moments. It brings you back to when you had to witness other forms of police brutality. And one thing that it was clear from the George Floyd incidents, or what brought to the attention of the world, is that so many people have their story. Everyone that is racialized, marginalized communities, they all have their story. They have a story where they felt this small. They had a story where they were being called X, Y, and Z based on the color of their skin, based on the way they look. And it brought attention to how big and systemic of an issue this truly is. And I mean, as I said, everyone has a story, and there's so many challenges. Like one of the challenges I always hated as a Black man was having to save face. You're in a medical. I remember being in class in medical school, and and a teacher, one of the instructors alluded to, who would ever want to come from Africa or live from Africa, or say something along those lines. And now all of a sudden 40, 50 eyes are on you to try and save face, to be able to speak up against that kind of hate speak. And that pressure, it's massive. It's massive, especially as you're in your formative years, especially as a young adult. Even now, it's something that I'm much more comfortable in my own skin. But man, it's such a challenge. And and we'll talk about how to handle these situations at the end here. But it's just, there's so many layers to when you are judged based on how you look. The other thing too is you're always, growing up with this, is like you're always cognizant that you're different. You realize that often eyes are on you. Like I'll give an example. I was at in Florida a couple of years back with some colleagues, and we were it was late at night, and I'm the only Black individual, and there was hardly anyone on the street, and they just beeline it across the street. They jaywalk, and I'm like, I'm not going to jaywalk in Florida. There's no way. Like, you have to be cognizant of, yet you're different. What can happen to you? Like it's just like when getting pulled over by the police. I have 3 sons. I'm not looking forward to the day where we have to talk to them about how they have to handle themselves when they get pulled over. But I had that conversation very early with my father. Hands on the wheel, yes sir. Make it clear that you're not doing any fast action that they could get upset about. You make sure that you get home that day, get home unscathed. Like, you do not engage in confrontation. And this is the kind of mindset that a lot of us are having to overcome. And, and a lot of these are rooted structurally, like, when it comes to that term structural racism, I'll get a lot of people ask me, what does that mean? And one of the, essentially it's the amount of structural inequities that one has to overcome to just get to a specific level. I'll give you an example. So I don't know how many of you have heard of the term redlining. So this was an issue mostly you see it in the States, where geographically, say in Chicago, there's a redlined community which is deemed to be less value. So they get less resources, resources such as schools, parks, recreational centers. All that is less. Your ability to get a loan is significantly more challenging. Your schools have less quality education, less quality teachers. And so for you to be able to, say, for example, get to college, get to university, you have to overcome all these structural inequities to get a seat, and this is what is embedded in so many places in society, even within our Canadian system. A lot of folks, when they saw the George Floyd incident, saying, hey, that's the US, that's not us. When you think of from the educational system, the term, I don't know if many of you heard of the term streaming, which is, based on I forget what age it was, like grade 9, grade 10, somewhere in there, you're allocated, or you're trying to push towards a specific area of education. So, you might be going through STEM, the medical side or the scientific side, or you're going through more hands-on work, mechanics and so forth. And definitely marginalized communities, BIPOC community, being pushed more towards the more hands-on work, the less educated work. And this is something, as you think as our 13-year-olds or 14-year-olds are being pushed towards that. That's structural. When we look at, even when it comes to healthcare, my goodness, one of my favorite interviews that we did was with Dr. Mike Curlew. He was at the time working in Sioux Lookout, and the stories, number one, from what he was seeing, would put you on your knees. But he mentioned, for example, that there was segregated hospitals up to the late 80s, early 90s. So if there's the white hospital and then the indigenous hospital, and the quality of care is not the same. And it translates to what we see now. Like, if in that area, in Sioux Lookout, he's telling me about times where they're running, we can't get clean water, running out of medications, including antibiotics, running out of sedative medication. So you got somebody that's a trauma or needing to be intubated, put on life support, and they don't have enough sedation for the patient. In Canada, in the 21st century, like, this is a kind of systemic structural inequities that we're talking about, that people have to overcome. We look at even another example, Queen's Medical School, 1918, saying no Black students allowed, no one of African descent, in their bylaws. First Black medical student wasn't till the late 60s where they were allowed to go to school. And this wasn't removed in their bylaws till a few years ago. This is structural, it's deep-seated. And this is the kind of stuff that one needs to overcome. It makes me think back about when I was a kid. I remember I was about, I said 14 years old. I wasn't a great student back then, and I was okay, and my dad really wanted to push. He's like, you need to step up your grade. So I remember bringing home a report card, thinking that, it was reasonable. And I remember thinking, Dad's going to be proud this time. I'm just going to show him, it's a lot, and I bring him the report card, and he's like, Kwadwo, I'm sorry, this ain't good enough. And I'm like, Dad, What are you talking about? Like I stepped up. Look at these grades, you know, like mostly in the 80s and so forth. And he was like, look at the color of your skin. You think that with that being this being good enough is going to get you to where you want to be? You think if you have the same marks as John Smith or you know a white colleague that they're gonna take the they're gonna take you over them? No, you got to step up. You got to overcome. You got to leave them with no choice. This is the level of of a performance that you're going to need to get to where you want to be. You can't be here. You have to be here. And I got to tell you, you see it on a daily basis. You see it on a basis. You know, you sit on on administrative boards. You sit on executive, like high level senior management, and there's not many people that look like you. You know, and I remember another story where I was walking through the ICU, and there was a young black patient, and he saw me walk by, and he looks at me, and he's like, "Is that guy a doctor?" And the nurse was like, "Yeah, that's Dr. K." And he was saying, "Oh man, that's amazing. That's so cool." And initially, I was like, "This is great," you know, like to be a potential role model for a young youth. And then at the same time, I'm like, you know, for me to be so rare to see this is a problem. Like, why are there so few of us that you know that it's amazing to see a black doctor in a city of 1 million? You know, like there needs to be some change. And I think once again, this is what has been fantastic about, you know, the post George Floyd era, is that we see the issue, you see the EDI movement, and you know there is that push for trying to embrace diversity. Because I'll tell you, for those that are still on the fence, diversity is an asset. It's a superpower. That added perspective, you know, it just adds, whether you're in business, whether you're, you know, in government, whether you're in healthcare, that added perspective allows you to be strong. It allows you to see more angles. It allows you to come up with more creative solutions. I'll give you another story when it comes to diversity. I remember seeing this, I've been told I was on palliative care, and I'm going to see this really curmudgeoned patient that just didn't seem to connect with anybody. And she was of African descent, and she's dying of her cancer, and just, you know, not very happy with the care. And I walk in the room. I'm wearing my Ghanaian lanyard, and I come with a little bit of energy, knowing that, you know, this is going to be a challenging case. And you should have seen her eyes light up when she saw, like, you know, somebody that had that shared experience. We talked about, you know, what it was like being raised by Ghanaian parents, and the proper pronunciation of your name, and you know, and it just opened up. And she talked about what her fears, she talked about her concerns, and until she died, it was a different experience for her. It was a one that was better received, and she got to open up and be herself. And you know, that experience for her and her family changed because of that diversity lens, to have somebody that, once again, had that shared experience that she could relate to. And you know, this is a thing, like we do see from a patient side somehow, like how the inequities play out. You know, when we look at US data in terms of Black maternal fetal health, when we know that, you know, Black moms and babies are more likely to die relative to white and Hispanic babies. We know, looking at Canadian data, that if you come in with a pain crisis, or for any pain related issue, if you're Black, you're much less likely to receive pain medications. And this is, you know, just a couple examples, but having that representation, having that diversity, there's a voice there. There's somebody that could say, like when I see a sickle cell patient and they put on their stoic face because of, you know, some of the historical mistrust, you know, and they're saying they need more pain medication. I can advocate for them and say, listen, there's a reason they're asking for it. And, you know, I've seen this before, treat the pain, you know, and this is the magic of diversity. This is the magic of having that those people that be able to step up. And, you know, in terms of, you know, further just reinforcing the inequities, like one of the things that we saw clearly with COVID, you know, this was hitting our people the hardest, you know, like whether it was the COVID itself, we were seeing, you know, a lot of essential workers, especially that first wave, you know, a lot of BIPOC community being hospitalized, being swab positive, dying of COVID. Horrible to see. We saw the impact of the restrictions on our community, knowing that, you know, school closures and so forth, being in multi-generational homes, how challenging it would be to get testing. And what was unbelievable to me was how, like, we weren't collecting that race-based data. You know, this is something that had to be pushed. And once again, having that people like from that diverse angle to be able to advocate for stuff like this, because when you know the data, you could act. Like some of the most beautiful things happening with the Black Physicians Association of Ontario, they were reaching, like when it came to vaccinations, going to communities, going to and articulating ways of and coming up with creative solutions to be able to bring vaccines and education to the BIPOC communities. Like, this is what we need to think about. This is what, you know, and this is why it was so important to be collecting that data and to have that representation. So solutions can be established, lives can be saved, you know. And you know, one of the other things that really was quite upsetting to listen to often was throughout the pandemic was you know, people being judged for vaccine hesitancy, and I think there was a lot of trying to think of the politically correct word, a lack of understanding maybe of the historical mistrusts that have happened in many communities, and specifically in Black communities. Like, you got to realize, for example, when you, I don't know how many know about the Tuskegee experiments, where Black patients, Black folks, were Black males from the 1930s up to early 70s who contracted syphilis went without treatment so that they could be evaluated. And so they were left to dement, they were left to die, and restricted of treatment so that they could be evaluated, and we could learn from that without their consent. And so that's not that, unfortunately, that's not that long ago. And people have these instances in their minds when novel or new interventions are being asked of them. And so coming at it with that lens and less judgment, and coming at it with the approach of, you know what, we'll take the time to educate, we'll take the time to go into the community and say why we think the vaccines are safe. That was one of my favorite, the first things I did on my Twitter feed was the second that I got, I had my dose, I'm like, I'm putting on a picture of myself getting vaccinated to show the community that I believe in the science, and this is such an important step for us. But, you know, this is part of the understanding of the hesitancy. It has to come from the why that mistrust is established. And like I said, a lot of this stuff is systemic and deep rooted, and really should you know, come with a level of understanding. So the question is often, it's like, what are we going to do about this? Like, we know about these issues, we know about how deep-seated this systemic racism is, but what's the action items? What can we do? And for the white folks in the audience, you know, be an ally. You know, like, be a positive advocate. Like, you know, one of the things that you'll see, whether it's on the, you know, social media or the news or the internet, when you were seeing like the Black Lives Matter, initial Black Lives Matter, people are like, all lives matter. I'm like, of course, all lives matter. Like people are saying Black lives are equal, even they're saying it matters. And this was met with resistance. We had a professional athlete that wants to protest against police violence, and he goes down on one knee as a a, a way of protesting. And this is too much for people to handle. And he's blacklisted and not playing football anymore. Like, be an advocate, be an ally, and be come from a place of compassion. And remember that every single person that is that is a visual minority has their story, and come at it from that lens. And don't be afraid to call it out. Don't put all that pressure on the especially those that are, you know, maybe younger or less experienced or new to your group. If there's a racist comment or actions being taken place, get that 5 seconds of courage and just say, hey, maybe what did you mean by that? Or like, did you want to rephrase that? Or is that what you really meant to say? And I'll tell you, as somebody that's witnessed it happen, being defended for myself, every once in a while, it means the world. It shows us that we're being seen. In terms of the BIPOC members of Black community out there, I'll say it, tell your story. You know, the increasing the awareness and humanizing yourself is massive. And I'll tell you, I don't enjoy doing these talks. It's a bit of micro trauma. You go back to those days and times where you felt this small based on how you're being treated. But I'll tell you, people relate to stories. People relate to you talking about your lived experience. And it, you know, there's going to be people in our audience today that aren't going to forget this talk. And, you know, if that person is now, you know, preaching, you know, the importance of diversity, inclusion, equity after this, that sometimes that could be amplified. And so telling your story, huge. I also encourage all of you guys, BIPOC members, Black members, like, rise up. We've never needed you more than we need you now. Aim high, get in those leadership positions, get into medical school, run for that, you know, run in that department. Like, this is your time. This is your time to aim high, because when you get a seat at the table, you could advocate for your people. And it came to, like, the reason I applied for department head, it was actually one of the other favorite interviews I had was with Chika Oriwa. She's I'm going to tell you, she's going to be a person of influence, and if she isn't already. But she was the only Black medical student in her class of 260 at University of Toronto, and started the Black admission application program. And during that interview, she just really pushed me and said, like, we all got to step up right now. We all got to do our part. And so for me, it was getting a seat at the table. For me, it was starting up, you know, Black mentorship program, so that we could really be a voice for our people and show that they can do it, provide them the tools so that they can swing for the fences, and they will have that mentorship and they will have that support. So important. And the last thing I'll say is, when you get there, when you get at that seat at the table, where you get that, you know, running a department or running a company, whatever it might be, just be cognizant that because you're different, there's going to be a lot of your challenges aren't over. There's going to be a lot of people that will want to knock you down because you have that different perspective, that different approach. And this is a real important time to lean on, you know, your support network, to lean on your mentors, and just be cognizant that it's not over once you get there. and this is something that many Black leaders that I've had a chance to connect to all could relate to, that there's going to be so many people that don't want to see you there, even when you get there. But knowing that you're not alone, that you have people to lean on, and this is something that you could still overcome. So, Mariah and Andrew, that is all I wanted to say, but I really wanted to thanks everybody for the opportunity to speak to this. And once again, if I'm going to leave with one message for those that are in the audience, is aim high, keep swinging. We need you. We need you to have that seat at the table to be able to advocate for our people. So keep swinging.
Aim high. What an empowering and beautiful message. Thank you so much, Dr. Kyermenteng, for opening up this really important dialogue that we're having. And I can see there's a lot of questions for you in the question and answer box. And I want to jump right into those in just a moment. But I'm wondering if you can just tell us about your approach, your podcast, Solving Healthcare, and what was the impetus for that, and why a podcast? What made you take that approach?
Yeah, good question, Mariah. So for me, it was I love listening to podcasts, and that was the number one reason why I chose that. Like some people do YouTube or what have you, but I just thought it's such a great avenue to have more nuanced discussion. But for me, what I noticed was, as a researcher, we were doing a lot of projects that would illustrate how to save healthcare dollars, and nothing was changing. And despite these papers, and I'm a big advocate of always trying to think outside the box. Like, if things aren't going as planned, you got pivot. And so for knowledge translation, we thought, let's just see how it goes to talk about some of these issues on a different kind of format. And I got to tell you, I'll straight up changed my life doing the podcast. It has straight up changed my life. I'm here now talking to you. My positions at the hospital board all wouldn't have happened. We started a charity in the community called Bridges Over Barriers to be able to support our youth during the pandemic, which never would have happened. The media, like, that's how I got a little bit of media presence. And so, man, it was a life transforming decision. And I guess those that are in the audience, I guess the lesson there is, like, not everyone needs to start a podcast, but if I highly encourage you to be thinking outside the box and think of creative solutions to whatever you're trying to achieve. Because I think right now we're especially of lately, I'm finding there's a lot of black and white thinking for solutions for everything right now. And if we're more integrative and thinking outside the box, more solutions could be made.
Thank you for that. And what an innovative way to reach an audience and tell your story and tell the stories of others. And Andrew's going to put a link to Dr. K's quadcast in the chat. I'm a listener, and it's phenomenal, really great stuff. So I encourage you all to give it a listen. There's lots of episodes there. And moving into kind of some of the questions from the audience, the very first one is, you mentioned collecting race-based health information and how important this is for advancing equity, diversity, and inclusion. Do you have any thoughts or concerns about when that data is collected and if it might perpetuate prejudices or stereotypes among racialized and marginalized communities?
Yeah, that's a good question. I think that was probably the impetus for why it was not being done in specific areas. And to me, it's all about the greater good, and I think if we have good intentions in mind, we got to go for what is more value. And I think being cognizant that potentially it could be abused and create some stereotypes and so forth, I think is an important step. But like, lives were saved based on that data. I promise you. Like, if we didn't have that data in light of COVID, there would be there would unfortunately be more people that would have succumbed to the disease. So the way I kind of justified in my head is, at a large scale or big picture, this is more important than the potential risk, or the benefits outweigh the risk.
Yeah, for sure. Thank you. And then the next question is around being an ally and allying with. Uh, and it's around, can you please give some examples and ideas about what you have found to be helpful for yourself from your allies? I often hear people saying that they want to help, but they do not know how to do it without disempowering the person they are trying to help.
Yeah, once again, I kind of lean on intentionality, right? Like I think like one thing that is challenging is during this, even doing these talks and post George Floyd, you'd have a ton of people coming to you and saying like, how do I talk to my friend about some of these racial issues, or how do I, like, putting a lot of pressure on the racialized person to come up with solutions and alternatives and so forth, where sometimes it's just like just either Google it or just approach it with a common, with that good intention, because it's a lot of pressure for people to come up with some creative solution. How do, like, when people come to me, how do I talk to my kid about racism stuff? Like, I'll tell you honestly, I'm not an expert in child conversations and so forth. I just could tell you that it's important to address. And so I think and maybe I don't know how many people would agree with this, but as long as the intentions are good, as long as you're trying your best to address some of these issues, like, I'll recognize the intentions are good, and maybe I give feedback at a time where maybe you're using a term that's not politically correct when referring to racialized community member. But if the intentions are good, like, ultimately I think that's the most important thing. But it's a tough one. It really is a tough one.
Thank you. And that's a good segue into this next question. So, drawing on your personal story, what advice would you give to children and youth to overcome systemic racism? How can we have these conversations with children and youth?
Yeah, I think do was to give children and youth to overcome, like, so as I mentioned, I have 3 boys, and I haven't had the talk, truly had the talk with them yet in terms of how to overcome some of these concerns. And I must say, I feel fortunate in that way. Like, it's 2022 as a youth is much different than what it was like when I was a kid. Like my kids' classes have multiple, racialized community members. It's much more diverse than when I grew up. And I think, I mean, what I tell them is, like, we plan to tell them is that this, unfortunately, is going to be part of your life, being judged based on the way you look, and knowing that they have allies, they have their parents, they have people that will always advocate for them, and realizing that they can't, this is unfortunately something they can't escape. And for our boys, there's a practical component to that, like I mentioned with the getting pulled over by the police. But as they get older, we're gonna continue to have those conversations similar to what my dad had with me, and in terms of specifically what you need to consider if as you go older. Like, you have to, you need them if you want to get into medical school. Think of how much more effort, or more, the high marks that you might need to have, and continue to push and aim high, and the importance of being an advocate, and be able to represent your people at a higher level. But it's challenging. It's kind of one of those things, like our oldest is 9, and in some ways you really don't want to take away their innocence, because they really, they don't see it as an issue right now. But yeah, it's a challenging one.
Yeah, for sure. And you mentioned aiming high, and so within medical school, what changes can be done within the medical school system to dismantle racism?
Yeah, I just think just recognize what the, what at a at a the university level, what the inherent biases are, what the structural concerns are. Like when you're in admission, like an admission committee should be diverse. Excuse me, it should be representative of those that are applying, and just being cognizant that this without that diversity, it's going to be hard to overcome some of those biases. I it's something as simple as just highlighting it often, and this is what's been great about this EDI movement is that just sometimes that's, I don't want to say it's enough, but often it's a lot, just recognizing that this is a concern. And by doing that, you inherently think to yourself, hey, like we don't have that much representation. Why is that? And start asking the right questions. And I must say, University of Ottawa has been doing great to do that, to acknowledge that. I know they have also have a Black stream for admissions, where a couple of our Black mentorship members are applying this year. Fingers crossed. So I think there's been a lot of positive movement from that perspective.
Yeah, and our next question is around diversity and inclusion initiatives in the workplace. So the question is, when could we see some success around these initiatives? How do we measure success, and given that they're run by organizations?
Yeah, that's a very good question, um, and off the top of my head, what I would deem successful is, within that industry, whatever it is, when you look at the staff, you look at the people that apply for positions, is it representative at the higher level, like at the executive level, at the management level? It's I'll just use an example off the top of my head. You look at NFL, right? The National Football League, heavy, on the Black communities when it comes to the athletes. And then you ask yourself, when it comes to managers, coaches, is that being represented? Is that being reflected? And if, which humbly it's not. And so then asking yourself, why not? And then, so to me, the success would be, is it more representative of what we're seeing at a league level, and similar in an organization, similar in education, university, medicine. Um, I think as a crude marker, I need to think harder about the answer to that question, but as a crude marker, I think that would be a good, at least, starting point.
Great. And Dr. K, do you believe the pandemic could help drive some change in the healthcare system? How can we overcome the mistrust that has evolved from misinformation and disinformation?
So the first part was that, do I think the pandemic drove?
Has
Can
it
you,
drove some change within the healthcare system?
I do think it did drive change. Like I honestly think wholeheartedly that race-based data and asking ourselves more of those questions have saved lives, and I think it has made it less taboo to acknowledge, that different outcomes might happen in different communities. And so, opening up that door to tailoring or personalizing treatments and interventions based on, who the person is, I think is huge. It's it's the future of medicine in some ways. So I think in that sense, it's been definitely move the needle.
Great, and I'm just going to scroll down a bit to comment here. Thank you for an inspiring presentation. How do we change the conversation in workplaces that look at BIPOC individuals like you that have overcome incredible barriers and hold this up as an example of how BIPOC individuals can succeed? All they need to do is work hard. This often becomes a roadblock to honest conversations about how white supremacy is embedded in the DNA of our institutions. How do we provide role models for BIPOC communities without letting the institutions get away with deeply embedded white privilege?
You know, I thanks for the comment. We gotta celebrate this. We gotta celebrate the wins. We gotta, you gotta, those that are in positions similar to mine are greater than mine. I'll say this is editorializing a bit, but you, in my opinion, you have a responsibility to rise people up around you, and whether that's giving talks like this, whether that's taking some uh, people under your wing and mentoring them, it's celebrating these wins. Like I did an interview with Rosie on CTV Morning News a few weeks ago in terms of celebrating Black History Month, and they were highlighting some Black community members that have done the community well, and that's exactly what we should be doing. Celebrate the wins, and when you see that, it's hard not to want to rise up and do more. And yeah, and I think, yeah, as I said, those that are in a position of where they can be a voice, you have to do it. You have to be that advocate. You have to be that role model. I gotta say, like, in 2022 right now, doing advocacy work and being a voice in the public is not easy. Like, there's a lot of people that are like, you get, personally, I get, there's the Twitter, like, evil messages on Twitter. You get some emails, personal emails, and stuff directed towards my family. But the guidepost, the thing that pushes you is, justice. Like, for me, is justice, and doing your people right, and being an example for my boys. And so having that in mind, knowing where your values are, I guess is what I'm trying to say, is a huge push to be able to keep doing this kind of stuff. So I think I'm answering the question, but
Yeah, no,
great question.
absolutely. Yeah, no, that's a really great response. And actually, that I wonder, like, how do you keep yourself well? These are heavy conversations, so how do you take care of yourself while having these conversations? And sometimes it might feel like you're taking one step forward and a few steps back. So how do you deal with that?
Yeah, that's an important question. I've and this is one thing I wish I had going through my journey, was a bit like a mentor to lean on. But I think mentorship, finding someone that has gone through similar experience, is helpful. For me, I know what my stress relievers are. I play a lot of sports and stay active. I like to keep moving. Like, so playing hockey for me, hitting the gym, all is huge stress relievers, and allows me to kind of be more sound of mind. Like meditating. I do. I mean, we set it up, this solving wellness on like, practically, because it's, the stresses of life, and especially as healthcare providers. So just to have, really trying to foster a community of people going through similar lived experience, which has really helped um, navigate through things. But just knowing what your supports are. Leaning on my, like, I have a fantastic wife, Kathy. I gotta give props to her as often as I can. Amazing family, and friends and colleagues that you could always lean on during tough times. But for me, the big thing is recognizing signs of when it becomes too heavy, or when you're getting close to burnout, slowing that down. You don't have to say yes to every engagement. You don't have to engage everybody on Twitter or social media when they say something negative. You could turn down, media requests. Like, there's always just kind of have that sense of where you're at, to be able to cope with some of these concerns, and then dial up or dial down and as needed.
Yeah, great. Thanks, Dr. K. And there's a question here, and you're in Ottawa, Ontario, and said the most prominent voices from the so-called Freedom Convoy are the very negative and divisive. So how can we leverage this time to have more positive and inclusive and anti-racist dialogues?
Well, great question. How can we leverage this time to have more? Yeah, I mean, there's so many things to that. Like the whole thing with the Freedom Convoy, I think, yeah, how would we become more, I guess what comes to mind is just to be, just always point out the examples of the opposite of people or groups that are not talking about the anti-race, not having that anti-racist dialogue, and people that, like, I can try to say this without judgment. There was this movement happened because there was people had concerns about specific issues. So are there still people with those issues that aren't speaking racist talk or hate speak, and giving them a voice, as opposed to highlighting the divisive hate language that we're hearing from the most like some of these prominent individuals. So just really thinking about balance. But I must say, like, bringing attention to putting the most loud and racist people on stage all the time is not helping. You know what I mean? Like, it really is not, it's not helping in terms of trying to create some cohesiveness. And so I guess ultimately, if we could have some of our leaders and folks highlighting, what are the central themes, and articulating in a way that is not divisive and full of hate speak, I think would be the first step that I could think of. But man, that's a hard question. Hard, but good question.
That's a big question for sure. No, thank you for that response. That was great. And and that there's a question here just around, do you think that Black history should be taught in schools and universities? Would that help decrease racism and advance equity, diversity, and inclusion?
Yes, I think it shouldn't just be Black History Month. It should just be history. Like, it's just like the amount of, like, the point of it is to try and normalize and make sure it's part of our mainstream education and so forth. And the fact that it isn't is the sad part. It is the reason why these Black History Month exists and so on. But that's the ultimate goal. Like, it's just part of history. You're going to know about the, some of the Black thought leaders in our community. You're going to historical thought leaders. You're going to know about some of the atrocities that happened, and you're not learning about them just during Black History Month. I think that's the whole goal, and it's definitely attainable.
Thank you. And we are coming up to an end on time here, but there are still some more questions. So we'll move them over to N4's meeting place, where Dr. Kyeremanteng has volunteered to engage in that dialogue there. I know it's dialogue that we don't want to stop here today. We don't want to just limit this conversation to 1 month, but keep it going. So we will move the questions there, but I do want to give you the final word, Dr. Kyeremanteng. If there's one message that you could leave with us all today, all those who are viewing or who will be viewing this webinar in the future, what would that be and why?
Maybe it is a bit about it being February 2022 and how divisive I feel like our country is right now. But I think just, have that focus of compassion. If we viewed our fellow man right now with the lens of compassion, and empathy, we'd be so much further ahead when it comes to whatever you're talking about, battle of racism or when it comes to health, education, everything. If we just had that lens of, hey, that's a person in front of me, and maybe I'm going to have that little bit more of a compassion lens, hearing what they have to say, knowing that maybe they're a little bit angry because they're going through a tough time right now, or maybe they're going back to that time where they were felt like this small. Like having that lens, I think could only make us stronger and be more empathetic and have those better conversations and get us through these tough times. And I think that would be the number one thing I would emphasize: compassion.
Gosh, thank you. Thank you very much for that. And I do want to extend thanks to you, Dr. Kyeremanteng, just for engaging in this dialogue with us today, for doing this talk. Andrew will put a link to your Solving Healthcare quadcast in the chat. And we also want to thank everyone who joined the webinar live today. We really appreciate your comments and your questions. And we hope that you will engage with us in some upcoming events. We do have our upcoming conference, The Past is Practice, Intersectoral Lessons Learned During the Dual Pandemic of COVID-19 and Systemic Racism. That is March 1st to 3rd, and there's no cost to attend that. And we invite you to attend and see some of the keynote addresses and different concurrent workshops that will be there. And of course, if you missed any part of today's presentation, or if you would like to watch this session again, we will have a recording posted to our N4 platform within the next week. And all the unanswered questions will be moved to N4's Meeting Place, an online moderated discussion forum. And we hope that you will continue the dialogue and continue to ask questions. And we've curated several resources related to today's webinar topic, and we will share these resources with you when we share the on-demand version of the webinar. So thanks again, everyone, for joining us. We hope to see you again at a future N4 event. Thanks, Dr. K. It was a real pleasure to have you have this webinar and providing this conversation to us. And we hope that you all stay safe and well.
Thank you so much. So yeah, I
That was-
wasn't sure if